Part of what makes asthma hard to deal with, especially if you're in the middle of an asthma attack or symptoms are starting to take hold, is that it can really feel difficult to breathe. And as that difficulty to breathe escalates, you can become more panicked. And as you become more panicked, your breathing is affected. And effectively, you're in a positive feedback loop that spirals out of control. There are a couple of things that we need to pay attention to here if we're going to manage these symptoms before they get out of hand. One is to be sensitive to your breathing and understand when those symptoms are coming on. The earlier that you can intervene yourself, the more likely you are to be able to stop those symptoms taking hold. The second thing is we need to understand what's happening with the mechanics of breathing and with the function of breathing so we can shift it in order to stop our excessive breathing leading us into an asthma attack or coughing and wheezing, or the need for emergency medications. What I have found personally is by breathing early, by using the Buteyko breathing method, once symptoms are starting to take hold, I don't need my medication. And maybe that will also be true for you. That said, there are times you truly do need medication, and sometimes you may need medical intervention. The Buteyko method is not something that is meant to cure asthma and stop it completely. It can help treat the symptoms and allow you to breathe better, but please, it is not the be-all and end-all. Be safe. The other thing that we need to pay attention to when we're having an asthma attack is our state of mind, our psychology, how we are feeling and how we are reacting. It is very easy to become stressed and anxious when we feel like we cannot breathe. Understanding that you still have the capacity to breathe for a lot longer than you feel that you do is important. When you're in the middle of an asthma attack, absolutely you will need intervention. At some point, sometime you may need to call an ambulance or go and see a doctor or go directly to the hospital. But if we can catch it early, we really do have the opportunity to improve those symptoms ourselves. Now, the heart of what the Buteyko breathing method does is it teaches us how to, number one, breathe lightly so we don't overbreathe and we allow the biochemistry in our breathing to find a balance so we don't hyperventilate and move into that realm where asthmatic symptoms take over. But it also switches us away from the autonomic nervous system sympathetic side, which is the fight or flight side of the nervous system, more towards the parasympathetic rest and digest area, which is where we're comfortable. This is where we should be when we're not doing anything active, when there's no danger, when there's no need for action. This is where we rest and relax. Now, clearly, if we're having an asthma attack, we're moving over to the sympathetic nervous system. But if we get stuck there, things can spiral out of control. When we slow and lighten our breathing, we downregulate the nervous system, we move over to rest and digest. Now, one of the key breathing exercises in the Buteyko method is called Breathe Light. And it's about reducing the volume of air that you take in. Now, what I need to say right now is this sounds very counterintuitive to an asthmatic. To say to an asthmatic who feels like they're not getting enough air, breathe less, sounds, well, to be blunt, it sounds crazy. And it did sound crazy to me for a long time. In fact, I didn't believe it until I worked with it myself. So if right now you're thinking this sounds crazy, that's okay. The only way that you can prove to yourself that it's not is by trying it. And if you want to try it, here is your opportunity. The idea with Breathe Light is to attempt to reduce your breathing volume by about a third. So you take in 2/3 of that normal breathing volume. Now, when you start to do this, it might feel very challenging because you will experience air hunger, you will experience a feeling of breathlessness, you will feel like you need to take a bigger breath. The only way that you can deal with that is to psychologically tell your body to relax, or just maybe allow your body to relax into the sensation of breathlessness. That's what Breathe Light is all about, reducing the amount of air that comes in and becoming comfortable with that reduction in air coming in. It is an exercise, it's a practice. You won't breathe like this all the time, but it will allow you to develop the breathing function and the breathing pattern that results in you breathing less throughout the day And it also gives you an opportunity to breathe as a practice in kind of the same fashion as if you went to train at the gym, you would benefit from that training. This is training that benefits you breathing throughout your days. And also you can use it as an intervention when asthma starts to take hold. So to practice this, we'll do it nice and simply and put one hand on the sternum, one hand just above the belly button, right around where your diaphragm is. Your diaphragm is the major mover, the major muscle of your breathing. We're going to close the lips and breathe solely through the nose. Now, if your nose is blocked, please look in the description for the nose unblocking technique video. It won't take too long for you to watch that video, and it'll take 5 to 10 minutes to clear your nose, and then you can come back and we can go through this again together. Hand here, gently breathing through the nose. Now just find your own natural rhythm. You don't need to force anything right now. Don't try and be perfect. Just ease into the practice. Through the nose, lips are closed. And when you're ready, just start to soften the breath. Ease off the breath. So with each breath in, and of course each breath out, less air is moving in each direction. Now this should be tolerable. It should not be uncomfortable, or at least too uncomfortable. You will get a sensation as you continue breathing of breathlessness. But it is tolerable breathlessness, tolerable air hunger that we're looking for here. It should not be difficult, challenging, stress-inducing. You're sort of pushing up towards your limit, but you're not going past that limit. So with each breath, you're just easing off till around about 30% of your normal capacity is reduced, and you're down in that realm of 2/3 of your normal volume of breathing. And take a rest. So as you practice, you may do 30 seconds on and a minute off, 30 seconds on and a minute off. It's just practice. There should be no physiological signals from your body, no flutter in your diaphragm or your throat, or a scream from your mind to breathe. You're just easing off enough that you can tolerate this feeling of breathlessness, of air hunger, of I need to take a breath, but not I really, really, really need to take a breath. It's just practice. If at any point through the practice it feels like it's too much, increase the volume that you're breathing in, and you may need to play with it to find out what point it actually is. It might not be that you need to reduce 30%, it might be 27.2%, I don't know. We use that as a guide. For you, it may be slightly different. You will know what's right for you. Again, this is not a competition. It's not about being perfect. It's about just practicing so you can train yourself, and then you'll be able to use this technique later to potentially stop asthmatic symptoms taking hold if you catch them early enough. It's been proven time and time again. There are piles of studies that have been done, peer-reviewed and otherwise, to show the efficacy of this breathing method. This idea of breathing light, and there are variations that I'm not going to get into in this video, this idea of breathing light is all about reducing the volume of air moving in and out of your body so you stop over-breathing and then you don't allow those symptoms to take hold. You're really taking control of how you breathe. It's training, it's practice, and it's building a foundation for correct functional breathing. If you have any questions about this technique, about the Buteyko method, about breathing in general, please leave a comment below and I will answer it personally. If you like this video, please hit the button, that thumbs up button, to tell the algorithm to share it to more people. Please consider subscribing to the channel. I would appreciate your support. Maybe sharing this video with a friend. I appreciate your time. I appreciate that you chose to watch this video. Thank you so much. Breathe easy and be well.